here to bump you up. Overdosing on prescription over-the-counter medicine can impair your overall athletic performance if you don't take it for the intended purpose.
You told me to have my husband stay away from Aleve. He was popping the Aleve like crazy, but he has high blood pressure and he's on 2 meds. So to stay away from that.
They could even be allergic to something, right?
Yeah, and you'd feel terrible if you gave that to your friend and then found them in ER and they died, or you know, that's the worst case scenario. But still, that's what can happen. So there's so many contraindications to medications and disease processes and all that stuff together, and your doctor knows that. So it really is not smart to just be giving somebody meds.
To address it, just what you just said.
Yeah, when a doctor considers a dosing for medication, he considers your weight, and then pharmacies, have done all kinds of studies, especially in the United States. You have to have a medication that shows so much percent of testing, and then the efficacy of the medication. And they know exactly what dose, how long the dose should be taken if it's for an illness, to help you feel better. So it's very important that if the doctor says you need 325 milligrams of Tylenol, and that's all with each dose, that you do that. You don't just decide to take 2 500 milligram Tylenols and get 1,000 milligrams. Dosing is very important for whatever pain you're experiencing or whatever infection that you have, that you're getting the dosing for. You wouldn't take a blood thinner and all of a sudden decide to take twice the amount, because then you would bleed. So dosing is very
Painkillers and the sleep aids and stuff are some of the ones that you see people sharing a lot, and nobody ever asks exactly what it is, or they don't know the side effects and things like that that go with it. Sometimes the side effects aren't that progressive, as far as like it may cause them to be anxious, but they just attribute it to stress or things like that, rather than understanding that it's a side effect of the medication too. And to just be aware of, you can't just take ibuprofen from anybody, because you're not exactly sure what it is or what kind it is. And something that I've learned working with drugs is you also don't know when the expiration date is, and that's always a big thing, because even if it's just ibuprofen, plain ibuprofen, they have an expiration date on them, and if after that expiration date, the chemical components of the medication change, and so then the side effects can change too. So it can be less potent or it could be more potent. And so, people take 4 or 5 ibuprofens at a time when they're for this or that, and if they're taking expired stuff, it may work, or they may have way overdosed on just taking, but people don't always check their expiration date. They always leave it in the cabinet, and mom's always had ibuprofen in there, but yeah, ibuprofen and that kind of stuff does expire. And I mean, working in the hospital, I saw that a lot. We've seen a lot of kids come in taking mom and dad's ibuprofen, but it was expired, and they overdosed on them because they took too much. When if it was in date, it would have been just fine. So that's another thing that people have to look out for too, is the expiration dates on things.
As an athlete, you need to know exactly what you're putting into your body. Instead of passing out pills, pass the rock.
Just educate. I tell you what, some of the best ads I've seen is to deter people from doing something harmful to themselves. The commercials and cigarette commercials where the people are topping out their trachea.
True commercials.
That's I can't hardly watch it. I mean, that's not clean. That'd make me want to hospital. And so the same thing with drugs. I mean, you know, if they get commercials and ads out like that, I think that would help. Just educate. Kids, stay in school and don't do drugs.
Well, one of the things when I was thinking about with young people, especially at the age of 11, sometimes we see that they have other medical issues, maybe having anxiety disorders. One of the things I read that was interesting to me was that the median age of onset is 11 years old for young people, and sometimes what they do to prevent the anxiety attacks is they just try to self-medicate. And one way of self-medicating would be, you know, using either alcohol or using prescription drugs because they think it'll make them feel better. But the reality of it is it doesn't make them feel better. In fact, it can actually increase some of the paranoia they feel, some of the symptoms of anxiety disorders. So I would just, like the young people to know that if they are having any anxiety, if they are having any fears, that, get to someone who can help them, someone they trust, someone they can talk to, someone who cares about them that can help them before they start trying to self-medicate. That's one of my
Prescription drugs can hurt your performance in sports, so don't take drugs from friends.
For you though, Joe, because you're
Oh,
good.
why are you in last place again?
It's because my head hurts, man. I've been getting hit with too many of these turtle cones.
You want some of these?
This ain't aspirin,
It's prescription.
so it works.
Very good.
Is that enough?
Yeah,